Hi, everybody. Welcome to the EyeCarePro Meaningful Minutes. We have today here with us Dr. Richard Shuldiner of the International Academy of Low Vision Specialists, the IALVS. Dr. Shuldiner and the doctors at IALVS have a story to share with us and how they've improved their patients' quality of life. So I'm going to, and in honor of this month's February low vision awareness, we're bringing Dr. Shuldiner and the ILVS to our meaningful moments. So I'm going to introduce Dr. Shuldiner, and he'll kind of take it away and talk to us a little bit about the IALVS and what these doctors do and how they help their patients.
Well, thank you, first of all, for having me on. I very much appreciate it. I think bringing awareness to those with vision loss is extremely important. I think they're our most uh, needy patients, and many times they're just forgotten. And I think it's time that we make sure we help these people who have difficulty. The International Academy of Low Vision Specialists are a group of about 39 optometrists throughout the United States and Canada. I've personally trained every one of them in how to perform a low vision evaluation in a private practice mode, how to be able to send the patient home better than they walked in, and give them a new hope for a life with some vision loss. There is life after vision loss. I thought that I wanted to deal with children. And after about a year of doing vision therapy and working with children, I found out it just wasn't me. And so someone suggested low vision. I looked into it. I uh, found a doctor who was a diplomate in low vision about 80 miles away from me. I went up and visited with him, and he was happy to train me. And I just love working with people with vision loss, the concerns they have, turning it around into something that they can do with their life. It just really turned me on, and I've been loving it ever since. This is my 50th year in optometry, and I'm
Wow.
loving it. There was this elderly woman came to see me, and her husband accompanied her. And she had macular degeneration, as most of my patients do. And I always start off with introducing myself and saying hello to the patient and the patient's spouse. And I asked her basically my normal questions, what are you having trouble doing? What do you want to be able to do that you can't do now? And surprisingly, the husband started crying. And so I looked at him and I said, "Are you okay? What's going on?" And because she hadn't even spoken yet. And he said, "She can't play bridge anymore. We do that every day. We have friends and we all play and we enjoy ourselves. And now that she can't play anymore, we've lost all our friends. They're out there all playing and we're sitting alone in our room just looking at each other because we can't participate." And he was just in terrible shape, worse than her, actually.
Mm.
So fortunately, I had a conversation with her, and yes, that's exactly what she wanted to be able to do. And we did the low vision evaluation. It was really no problem in terms of low vision helping her see the cards. Um, I learned enough about bridge. I don't know anything about bridge, but I suggested, larger cards. Oh, no, everybody plays with the same cards. It's contract bridge. I have no idea what that means. So I was able to get her to see the kind of cards in her hand and the cards on the table and see her partner across the table. These are things that I learned right then and there that I had to be able to have her do so she could successfully play. And they went back to playing, got their friends back. It was very, very satisfying. I was very, very pleased that I could figure that out for them and send them home much happier than they walked in. It's a wonderful feeling. And I do a lot of training of optometrists. So IALVS doctors have all been trained by me. And I get tremendous satisfaction out of seeing the patient be helped. I get even more satisfaction out of seeing my doctors help hundreds and hundreds of patients. Being a low vision doctor is different than being a primary eye care optometrist. One has to really just figure out, evaluate what they want to do and get them doing it one way or another. Yeah, and getting them on an eye chart to see 20/20 or whatever. No, that's not what it is. It's very unusual. Every case is completely different because you never know what the patient wants to do. The number one question I get from patients is, why didn't my eye doctor tell me the service was available? That's the killer.
Mhm.
I hear so many times I've been told that nothing more can be done. So my message is, just don't say that anymore. Don't say nothing more can be done. Just say to the patient, look, there are low vision doctors out there. I'm sorry I don't know of one, but if you get on Google or have your family member get on Google and search low vision, you'll get help because there are people who can help you. That's all you have to do to turn that patient from depression and anxiety into hope and independence.
Okay. Yeah. Thank you. Thank you very much for sharing and thank you for joining.
You're very welcome. Thank you for having me.